Welcome, everybody, to Sooner Politics Special Report. We've got a lot of things happening tonight. It's Monday, March 23rd, 2020. Happy birthday to my sister Colleen, the big 5-0. Hope you're doing well. Just ask you, those of you who, people of faith, say a prayer for her. She's a flight attendant and is suffering some bad symptoms and is under quarantine because she's been in contact with a pilot who should not have been flying. So I don't want to mention too much more about that, but God bless you, Colleen. Stay well and happy birthday. All right. We're getting to Sooner Politics Special Report tonight. I'm David Van, the founder of Sooner Politics, and we've got a lot going on. I wanted to take this time to just come before you on a webcast live event and to podcast and talk to you a little bit about what's been going on here in Oklahoma in the last week. As you know, the COVID-19, the Wuhan flu, as some will call it, the Chinese flu, as our President Trump calls it, one of the coronaviruses is hitting the world, and it's a plague like we've not seen in 100 years. It is having a big impact all over the United States, not so much in Oklahoma as it is in New York City and along the West Coast, particularly Washington and California. So we're going to go through a number of things that are happening. Some things happening in Oklahoma that you need to stay caught up on. Trying to be as supportive as we can of our elected officials and appointed officials, people that are put in place for times such as these. I want to say a special thing to my friends with Oklahomans for Health and Parental Rights. It's not your fault. You didn't cause this. You're making independent decisions for yourself and your family regarding vaccinations, other inoculations, and other practices is totally and ultimately your call. You didn't cause this. Don't listen to the people who want to blame people who believe their body still belongs to them. All right? Now, let's get on to the first story tonight. Let's do an update. Sooner Politics has commissioned a new section on the front page of SoonerPolitics.org. It's particularly for the coronavirus updates, and it's coming from the Oklahoma Department of Health primarily, but we have some other sources on there. You'll see it right up there under the masthead, top and center. Be sure to keep an eye on that. We're going to have updates by the hour. I just checked and saw that the health department in the last 2 hours gave some updates. Currently, we're standing at 81 confirmed cases as of this morning. A week ago, we had less than 10. A week ago, our legislature was supposed to be on break. They were called in, I believe it was on Tuesday morning, for a part of the regular session, meeting that was called particularly to deal with contingencies. And we're getting into constitutional and very principled issues regarding representative democracy. What came as a result of that is an unprecedented rule, a Rule 15 in the House of Representatives Handbook of Legislative Rules. They've always had 14. Now we have 15. And it allows for proxy voting. Our representative form of government is now allowing our representatives who we voted for directly to then select another representative to go in their place of their choosing. That has a lot of people concerned, and it should have a lot of people concerned. What came about after that was a very interesting dialogue on SoonerPolitics.org's Facebook group, where we discuss a lot of the issues that come out in the news that we cover and other newsmakers cover. My former state senator, Don Rubottom, who has been a clerk of the Florida House for much of the last 20 years and served in other capacities, after leaving Oklahoma, after leaving 8 years in the Oklahoma Senate, really had problems with this. He began a dialogue with no other than our House Majority Floor Leader, John Eccles, a man I personally admire, a man who's been a straight shooter with me. And the two of them had a pretty strong debate. The Judiciary Committee chair, Chris Kennedy, stepped in. It was a pretty blunt, and that's sometimes a little bit personal by different players. But I consider all of them to be serious about this. I will say this, Don Rubottom's a man of high character that I trust. Yes, does he have a lot of self-confidence? You bet he does. Don's always been that way. Ever since he was my neighbor and first knocked on my door and said, hey, I'd like your help in the primary. I'm running for Senate. And so John Eccles, one of the humblest men I know, one of the most approachable men serving in our legislature. But I want to encourage you, go to Sooner Politics, click on the editorial tab, soonerpolitics.org, and scroll back a week. There's a lot that's happened since then, so there's a lot of stories. You'll have to scroll back. But take a look at that. So, because that offers some interesting take. And then my friend Jameson Fott, the publisher of Muskogee Politico, published an official paper from Representative Tom Gann. Tom was one of the people who debated strongly against this measure. And Tom wrote a position paper on this. Tom is somebody I also highly respect, a solid man. Those of you who know him know what kind of a man of integrity Tom's been and has demonstrated. So take a look at that. I'm basically going to say, you decide. How do you feel about this? Now, I'm going to say this in all honesty. Eccles said on the floor, we're going to pass this and then never use it. And they haven't in the last week. But he wants to have some kind of contingency for emergency beyond the scope of what we're even imagining now. Moving on, our school districts are all shut down by order of the State Department of Education, Joy Hoffmeister. Joy didn't just decide to shut down all the schools. She put a couple of caveats in there. Those have gotten her in trouble. One, she decided we got to keep gathering the children together for meals. Well, if gathering in groups of 10 or more is not a good thing, then why are we gathering them for that? Is providing meals a core function of our Department of Public and Common Education? No, it is not. So that's one problem. She got into it even further. She mentioned to me, she mentioned to one of my sources that our virtual charter schools have been told, shut down. Don't allow people to continue their education at home. Well, that's got a lot of people upset. Now, ultimately, you can't stop somebody from reading a book, and they didn't totally shut down the servers where the curriculum and online textbooks are. But she said the online charter schools cannot allow their teachers to have any instructional contact with the students. Well, that didn't go over well. In fact, talking to one of the virtual charter schools, they said they were on a conference call before this rule came down when Superintendent Hoffmeister said she was going to implement this. Another superintendent from a brick and mortar district, local district, said, wait a minute, are you going to allow Epic and the other charters to continue? And Joy was heard by many as saying, well, no, that would be like price gouging. They're afraid that the online and the charter schools will get, well, they already have the advantage. They will be seen as advantageous for families wanting to continue their children's education, their children's preparedness for life and for higher ed. And so this went over like a lead brick. On Thursday, I wrote a story. I did a lot of research, talked to some very prominent Oklahoma families who are also parents of children enrolled in EPIC. And they were very concerned. This looked like blatant protectionism of reputations of the old guard, bloated and ineffective public school principals. So she's protecting them. This is a problem. We need to fix this. So Friday, later on in the day, towards evening, I got a text back from one of the leaders of an online virtual charter saying as of April 6th, they'll be able to resume. Why the 2-week delay? Spring break's over. I can understand last week there not being anything going on. But why do we wait another 2 weeks for our kids who are at home safely with us and with parents and with supervision to be denied access to their teachers, who I might add are being fully paid right now? Now, what are our teachers doing? They're ostensibly working for us still. Are they taking, for instance, their continuing education credits, the units they need to keep their license up to date? It's generally a good principle of, staying informed on the educational process. So I think that's a good thing to be doing, but I have to ask, why don't we have them doing that? Well, Joy Hoffmeister said, no, they can't even do online training to keep their certification. So we've got some real problems here. We've got a system that's putting a priority on feeding poor, hungry children above providing education. Now, if you're the Department of Health and Human Services, I get that. But we already have that department. Why is our education department focusing on socialism and socialist agendas rather than education and advancing and preparing our next generation for success in life? So that's another story. You can find that on SoonerPolitics.org. I did a research last night that I want to talk about because it's a bit troubling. We've heard the story, the narrative that there's a 2.3% fatality rate with the COVID-19. And that's based largely on the Chinese experience, which is a highly, highly, highly discredited source. China has lied, China has denied, China has hidden so much from us, we don't know the story there. So our next model for looking at this is the next nations who've been impacted. That would be Iran and Italy. Those two came next. Iran's another one. Don't know how much information they're going to give out. There's very little access of free media, and the Western media, open societies just don't exist there like they do in other places. That leaves us with Italy, part of the European Union, part of NATO, and their numbers look horrible. The reason I'm bringing this up is people are taking the number of people infected and then the number of people that died. And if you use those numbers, Italy has an 8% mortality rate. 8%, not 2.3. Okay, you say, Dave, well, average it out. Look at on the other side of their northern border in Germany, and it's about a 2%. Well, okay, fine. The problem is when you take the numbers of people who are still hanging on for their life, still don't know that they're going to survive this, and you make those people another part of your success story and say it didn't kill them, well, the answer is didn't kill them yet. What we really need to find out the mortality rate is take the number of people ultimately who survive and compare it against those who died from this disease, or primarily the cause of death was brought about by this. Yes, I understand some of them are complicated because they have 18 other health problems, and some of them very serious. But right now, that doesn't look good. No, it's fair to say, Dave, it might take 3-4 weeks to get over it and then reach a place where medical professionals can certify, yes, this person's fully recovered, and we're reporting it downstream to all of the public health records. So we don't have much of that yet. Sadly, it doesn't look like it's a 2.3% mortality rate. Part of this is attributed to the public health infrastructure. Good news for those of us here in the United States is we have the highest rate per capita of ICU beds. That's intensive care unit beds. These are beds that have access and are set up for the best life support systems, which include the ventilators. Those are the machines that not only can make sure that you're getting plenty of air, they can do your breathing for you. Okay? They will literally pump the air in your lungs when you're not even strong enough to take a breath. We have those to a greater degree than any other country. Next behind us is Germany. Germany has a very low mortality rate. I think there's a connection here. From Germany, you drop off to the rest of the European nations that are maybe half the per capita ICU beds that Germany has. And you see societies that are just overrun. Spain, Italy, Portugal, United Kingdom. Look at Denmark. What do these have in common? They're socialized nations where the government says, we're going to be the ones to decide how many beds are necessary. That means private healthcare markets don't exist. Or if they do, good luck getting funding. This points to the issue we have with socialism, because we got a very troubling report yesterday. Came out of Jerusalem Post. Jerusalem Post did an interview with a doctor who's actually trying to help out in northern Italy. And the doctor says that, unfortunately, they are now ordering us that nobody over 60 years old gets an ICU bed. Instead, we do our best to make them comfortable with what we got, and we allow their families to come in and have some communication with them. In other words, prepare to die. These are the death panels. The death panels that we've been told didn't exist by Obama. We were told by Sarah Palin, oh, yes, they do. And when we get this socialized medicine, who pays for it? The government. Who makes the decisions? The government. It's an inevitability. Now, that doesn't mean it has to be that way. Again, Germany, socialized medicine, however, they prioritize this. And hats off to Germany. You're doing a little bit better. But these are the kind of systemic problems. And by the way, Germany, you're doing better right now. Okay? So that's a story on COVID-19. A little later tonight, by the way, 3D Politics Live, which I'm a panelist and part of, we're going to have a abbreviated, a little bit different show. We've got some correspondence, and we're going to have to do some of this by tape delay, and we'll be putting up the podcast later tonight. But we'll be doing part of it in the studio here. I just won't have the other guys, Tom and the two Davids, with me. But we do have some reports from out on the field, some things going on. So I want to encourage you to watch for that. Let's talk about some other news we've got going on, and that is the good news with COVID-19. Those of us who are infected, and I'm not, those of us who become infected, which you have to say, eventually we'll all be dealing with it. All right. 81%, according to the modeling we have right now, of current and previous patients, 81% will be in the mild to moderate, which means no hospitalization needed. You're going to do fine. You're going to get over it, according to this study, which actually comes from the European Center on Health Data. Another 14% on top of that 81% will have some severe cases, and which will likely mean hospitalization. Now, severe is different from critical. 14% just say, hey, for whatever factors we've got, whether it's the symptoms we're seeing or the vulnerabilities that this particular patient has, it's going to need a little bit better monitoring, probably an inpatient stay. Then there's the 5%. Those are the critical cases. Of those 5%, that'll be septic shock, multiple organ dysfunction or failure. These are all the ones who types. And according to that same data, they're saying of this pool, this model, 2.3% have ultimately died from it. So going into ICU puts you at about 5% of the most serious cases. And even of those in ICU, a little more than half will ultimately survive, according to the European Center. So what have we been told that's true, and what have we been told that's a guess, and what have we been told to that's ultimately not true at all? Remember when we were told a couple weeks ago that you don't need those masks if you're healthy? Just go about your day, you're fine. In fact, the masks might make you worse. Well, it ends up that's not true. Now, we all agree if you are infected, we do want you to have a mask. We want to contain that virus as close to you and as far away from the rest of us as possible. That's true. However, a mask still does help. Now, why would we not be told the truth on this? I'll tell you why. There's a huge shortage in masks. These masks, they want to have go to the hospitals first. Hospitals want to make sure they're taking care of the healthcare workers. And ultimately, if you know that you're going to have to work around people who are contagious, you'll want what's called a respirator mask. These are the industrial quality, the hospital quality, which have the thick, great big filters on them. They are usually a rubber seal. Not only do you see them when you're dealing with contagions and crisis like that, you also see them in industrial work, whether you're dealing with trying to clean mold or asbestos out of a building, they'll have to wear those. So those are that's actually technically called a respirator. When you hear a clinician in a hospital refer to the ventilators as respirators, that's creating a little bit of confusion. There's a respirator mask, and then there is an ICU ventilator machine. Ventilators are used in the intensive care units. They're also used in the surgical wards, the surgical suites, when you have to be prepared for all contingents. So, we were lied to on that. Just flat out, you just were. My daughter, who actually works for a supply house for institutions, mentioned to me last night, that they're prioritizing the hospitals. They provide all kinds of things, and they said, the masks, the respirators, all kinds of, paper towels and toilet paper. She said, hospitals come first. Now, this is a division of a very well-known home improvement store, big national chain, that they have a division that focuses on their industrial and institutional customers. So she says, we're prioritizing for this epidemic in all aspects of our economy. You're seeing industry that is retooling, may not have been involved in anything medical related. Now they're saying, you know what, we can tool up for that. Whether it's a pharmacy down in Blanchard that says, you know what, we can make hand sanitizer. It's not that difficult. And so they started doing it. So these are some of the things that are going on to get our society a little bit better prepared. Let's see, what else we got going? I'm just going to scroll through some of these. Joy Hoffmeister mentioned tonight to some people that she's probably going to ask that we just cancel the school year completely. Some people aren't going to like that, hopefully, and I'm still waiting for word back from one of the charter schools. Let me just see if I've got that. I believe I did get a text back from one of my sources. It's my understanding that her recommendation to the State Board of Education in the action they will take is all public schools will resume the year April 6th using virtual or remote instruction for the remainder of the year. Well, that would make sense. She said no person-to-person instruction. She's going to want everybody to move over to the model that Epic Charter has been the king of, and make this online instruction. She told all schools Friday that they should be planning preparing to serve students virtually. So, everybody's going to be an EPIC charter now. Who knew? And that's coming from one of the administrators of a virtual charter here in Oklahoma. All right. So that's breaking news. It just happened right now. Just got word in. And let's talk about the human part of this. My wife just saw on social media from the contemporary Christian music artist going way back to the 80s, Sandy Patty. Sandy mentioned that she's contracted it. She actually lives in Oklahoma City along with her husband. And have not heard much about how she's doing day by day. That report came out a couple days ago. A man who works at Oral Roberts University as a groundskeeper and also pastors a Pentecostal church in town, Metro Pentecostal Church. He was diagnosed on Tuesday. He died on Wednesday. He was 55 years old. We got a report today from a man just up on the north side of Keystone Lake, half hour from Tulsa. Man in his 50s. We don't have a name. We don't have an exact age. He also died. That's 2 fatalities, both of whom are in the broader Tulsa metro area of the state. So we've got 2 deaths. We're up to 81 confirmed diagnosed infections. What's it going to look like a week from now? We went from less than 10 to 81. These things do not climb linearly. They climb exponentially. If those 9 that we had a week ago at this time are now 81, these 81 will be several hundred, perhaps thousands a week from now. This is using conventional modeling. This leads me to the last report I want to say, and I'm going to credit Ben Shapiro, podcaster, radio broadcaster, journalist, married to a very sharp doctor. If you listen to his opinion of her, UCLA graduate, UCLA Medical School. And he says, ultimately, what we're trying to do, you've heard this say, flatten the curve, and it's true, flatten that curve. We've got to try to slow down this spread through slowing down our interactions so that do any less people ultimately get infected? Probably not. But when it happens over a greater period of time, you don't have such a crunch demand in a short period of time for so many first aid and life support medical resources. He said, the idea of herd immunity, it's a principle that exists. And he said, but herd immunity as a model doesn't become viable until at least 60% of the population has it and has overcome it and has built up antibodies against reinfection. That's going to take months. It just is. And in that time, we've got a lot of things to struggle with. We're going to have a lot of people suffering. We're going to have a lot of people dying. If half of the population of your county gets this disease, this flu, and 2.3% of them die, let's just use those numbers. Sadly, I think those numbers are on the low side. We're talking hundreds in some counties, several thousands in other counties, perhaps tens of thousands, on top of the other health crises and issues that we deal with. And then you've got other factors, such as poverty. You have people without work. We have people not spending money, not contributing to growing the economy. Got a lot of things happening. Our society will not be the same again. And this is where you lean on a higher power. And for those of us who have that peace, have that higher power that sustains us, it's a time to refresh that. Hug your family, call your kids, call your parents. Get used to phone calls and emails and communication in a different way. And ultimately, encourage each other. Go easy on each other. You're cooped up with people that you have issues. You know, things come up, and issues that you were able to put off by avoiding each other, you can't do anymore. Get help, and be that help for somebody in need. I'm David Vann with Sooner Politics. This has been a special report. Thank you for being a part of it tonight. And I look forward to 3D Politics tonight as we do a special broadcast, a little bit different. And stay in tune. Have a good night.